Welcome to episode 6. In the last episode, you learned about the relationship between toxicity and autoimmune disease. In this episode, we will be looking into diseases related to the brain. You will find out about how brain deterioration and Alzheimer's can be properly treated, and you will also find out about the shocking truth about the connection between vaccinations, autism, and attention deficit. You're going to find out how our brains are deteriorating, and you'll learn about the effect of chemicals on your brain. You'll also learn the functional neurology concept as well as nutritional protocols for mental health. You're going to see the amazing stories of the people that reverse chronic brain inflammation and also dementia. The reality is, finding the solution to brain degeneration is critical to help address more than 1,000 diseases and disorders that cause hardship for almost 1 billion families worldwide and many billions of dollars in medical expenses and lost productivity.
Autoimmunity has a huge role to play when it comes to brain health. Many individuals don't recognize what a massive role the immune system plays in the functioning of the brain. And as we do comprehensive assessment of brain function, looking at objective markers, because as you know, I believe very strongly we need to examine this organ and its function, so we better can respect it and direct therapy that's appropriate to improve that brain function. We are astounded how often autoimmunity is a comorbid condition or one of the factors that cause the entire dysfunction of the organ.
When you find someone has an autoimmune component to what's bringing them to see you, whether the symptoms are brain fog or poor memory or anxiety or depression or schizophrenia or bipolar or whatever, attention deficit or whatever the manifestation is, and you find there's an autoimmune component, how do you begin to address it?
Well, I think the first thing is to suspect it. You know, that's really the biggest challenge, frankly, is that many clinicians don't think that brain autoimmune, but many of our degenerative conditions, Alzheimer's disease, Parkinson's disease, multiple sclerosis, lupus, and even the less well-defined entities like brain fog and confusion, we even see some import into depression, anxiety, and functional disorders like attention have a partial contribution from autoimmunity. So the first thing is to think about it and to recognize, wow, there's an area where I can have an influence. I can potentially change the trajectory of my health. So when I do think about it, we look often at predictive antibody testing because we find that to have a line in the sand, a clear understanding that the body has turned against itself in the realm of neurologic functioning gives us a very clear direction upon where we need to go next. It's all about peeling an onion. It's really about digging deeper, one layer at a time, to find the underlying root causes of that individual's diminished brain function.
You know, here's the thing. A lot of people think to come see me because heart prevention. I mean, that's what I think they hear from their friends or they read. And I see that they have all the risk factors for heart disease. Their blood sugar's up, their inflammation markers are up, they're unfit. But on the inside, really, their brain is shrinking too. And they feel what I say the best description I can say is brain fog. I say, do you have brain fog? And they go, well, how did you know? I go, I would just look at your data and I'm sure you have brain fog. I mean, it's just no surprise. And I do cognitive testing, so I actually measure for executive function, brain speed in all the patients I see. So I can look and see that correlation between how fit are you meeting your nutrient needs, are you eating junk, is your blood sugar up, are you inflamed, all of those, it's so strongly correlated. Doing the right things improve your cognitive function. So I hear that's one of the most common, when I ask, it's maybe not the first thing they think to complain of, but almost all of these folks have this dysfunction of the brain, that their brain, and it has to, you know, blood sugar, when you have mild insulin resistance, you're not sensitive, you're a little inflamed, and your brain cells can't take blood sugar. When you have insulin resistance, you can't feed your brain. It doesn't get energy, it's energy starved, and it doesn't function. And that's the first step to cell death and brain shrinkage and Alzheimer's, memory loss.
We found in our practice that 26% of everyone that had elevated antibodies to wheat, any of the peptides of wheat, 26% of them had elevated antibodies to their cerebellum. 22% of them had elevated antibodies to myelin.
Okay.
That's the mechanism of MS. And when we got them off of the foods that they were sensitive to, wait 6 months or a year, go back and recheck, the elevated antibodies have come down to normal. So you stop the deterioration of the brain and the shrinking of the brain.
Neurodegeneration, yes.
That's right.
Well, and I see that too, because when we do gluten testing, I'll see that many people who, especially if they have anxiety or depression or really bad cognitive dysfunction, they have the antibodies light up on the tests that are specific for brain antibodies.
That would be transglutaminase 6.
6.
Yes. Yes.
There
They
you
light
go.
up. They just light up.
Transglutaminase 6, they just light up.
Yeah, that's remarkable. And then applying the lifestyle principles that you are recommending, it takes just a couple of weeks and then people start seeing the changes.
Within a month.
Wow.
I mean, honestly, 2 weeks better, but by 30 days, it's inspirational.
Yeah.
To hear them, the challenge is getting to do it. When I hold up my magic wand, I say, this thing, I could touch you with it, that won't be enough. You actually have to follow the plan. If you follow the plan, the magic wand really works.
So when neurons die, they die, okay? All these new research on what they call neurogenesis isn't dead neurons coming back to life. What neurogenesis is that existing neurons can branch over dead ones into new ones and then function can come back.
Very cool.
So there is a point of no return. And unfortunately, when people are scared about neurodegeneration, they sometimes don't want to go to their doctor or work with someone to identify their focus issues or their attention issues and their memory issues and those things. And then what they've really missed is the opportunity to actually do something about it. Because as time goes on and as healthy neurons die off, they're so far away that they can't branch into each other and then you lose function. But if you catch in the early stages and the neuron dies, there's still healthy neurons close enough to each other so they can connect and activity can come back. So there definitely is hope, but there's also a point of no return. Now, what's the scariest thing is when people actually lose their blood-brain barrier and have immune chemical reactivity, and then these chemicals start to interact with cells in the brain called glial cells. That then can turn on this autoimmune reaction against the brain. So around our brain, we have this wall of blood vessels and immune cells called the blood-brain barrier. So things like stress, certain medications, alcohol abuse, drug abuse, severe inflammation, they can all break down this barrier. When that barrier is broken down and a person has already lost their tolerance, as those chemicals get exposed to immune cells in the brain called glial cells, you turn on this inflammatory cascade that can then turn on brain autoimmunity. And once they develop brain autoimmunity and they have reactions to chemicals, literally their chemical exposure can cause brain inflammation.
Which will accelerate the brain deterioration
Absolutely.
much more quickly. So your blood-brain barrier, think of it kind of like, tell me if this is correct, kind of like the webbing inside a football helmet.
Right.
That if you just put the helmet on, it's a hard shell that bounces around, but you have this protective barrier that's really tight and not much can get through there.
Right. So that's the key thing. And we even see traumatic brain injuries have shown to break down the blood-brain barrier within the first 2 hours. So even these small hits to the head that people are playing in high school sports.
Like headbutts in soccer?
Yeah.
Or being tackled in football, the head trauma that they get?
Right. So some of these mild head traumas break down the blood-brain barrier. Now, if they have that in a combination of other things, maybe it was the right chemical exposure, maybe their immune tolerance was weak. Maybe, here's an example, the right set of events happened. They didn't get much sleep. They consumed alcohol. Then they got a head trauma. Maybe a mild one. Maybe they bumped their head. That combination and sequence could be what triggers something devastating for some people. So this is what we're learning, that everyone's uniquely different, but it's how these things all add up that makes sometimes the clinical impact. Mm-hmm. But a lot of people that have brain autoimmunity, as soon as they get exposed to it, they lose brain function. They can't think, they can't concentrate, they get brain fog. So where their immune attack is can sometimes be a clue from how they feel. But the fact is you would know if you're reactive to these chemicals for the most part, if it's progressed, because you feel a certain way around it. What people do is they just ignore it. Or they think everyone reacts to gasoline the same way, and then they think that's okay. but they don't realize that those constant little exposures to plastic bottles and coffee lids and benzene ring fumes, if they've lost their tolerance, can be devastating.
If you think of what symptoms could occur, say in the brain or nervous system, if there's an overload of mercury, common symptoms are anxiety disorders, depression, and
So brain symptoms.
yeah, the Mad Hatter.
The Mad Hatter, we know that term, the Mad Hatter, and
Yeah.
for those that don't know, it was in the 1800s, I believe, that the men that made hats for the gentlemen of society, these big hats, they would dip the hats in liquid mercury, isn't that correct?
Right. Fur hats.
Fur hats.
Yeah, so they would put the mercury in the fur hats to make it a better color, I think.
And what happened for those people making the hats is their brain function got altered. They became highly anxious, sometimes a little schizophrenic,
Yeah.
and the term became for that profession Mad Hatters.
Yeah.
And that's where the
Mad
term
as a
came.
hatter.
And it's a mercury toxicity that caused that. Like we know for landscape workers that they have a much higher risk of Parkinson's disease because the chemicals they're exposed to tend to cause damage in the area of the brain where Parkinson's develops.
Now, of course, not everybody who is exposed to mercury develops Mad Hatter syndrome or, chronic pain, chronic fatigue, gut problems, hormonal dysregulation, because a lot depends on how we are designed for detoxification.
I worked with a lot of early onset Parkinson's patients, and the vast majority of these people had just been diagnosed and they hadn't yet started to take any medication. And as you well know, and all the doctors listening to this know, when people are first diagnosed with Parkinson's, there's a hesitation to recommend the Parkinson's drugs because the drugs only work for a certain period of time, then they start to make people worse. And so the motivation is always to delay the beginning of the use of the medications for Parkinson's as long as possible. And interestingly enough too, during this maybe 5-6 year period, most of these Parkinson's patients were doctors themselves, which is interesting. So, someone with really good medical training understands that these medications are a slippery slope and they try to, put that off as long as possible. And I'm sure this is not always true of Parkinson's, but I think with many early onset cases, there's a very strong toxicity component. And there's either heavy metals or chemicals or some kind of a neurotoxin that's damaging the dopamine centers of the brain. And it's never as simple as just detoxifying the person and then they get better, but that's a really essential component for most of these neurological conditions.
I just read a paper, relates to this, I just read a paper that Parkinson's patients consistently, for years before they have symptoms, they're highly constipated. For years beforehand. And so it's in the gut, and there's something out of balance in the gut, which is consistent with your saying about toxicity, and it accumulates there in the gut. And they looked at the amount of antibiotics that they had, and with the higher, if it was one dose of antibiotics in the last, I think it was 10 years, in the last decade before symptoms began, their Parkinson's would progress at a certain pace. If it was 2 doses of antibiotics, it would progress faster at 3 and 4. And you saw this curve of how quickly they would degenerate depending on how many prescriptions for antibiotics they had during the time that they were constipated.
That's fascinating, isn't it?
It really is. So it's back to toxicity in the gut and detoxing and breaking things down.
Yeah.
Please continue.
Yeah. And I think one of the dynamics that happens is that toxins that are generated from the gut or environmental toxins that we get from breathing and from eating food that's toxic or from our dental work, wherever it may come from, accumulate. And many of these toxins go right into the brain tissue, past all the normal protective mechanisms that we have with these layers of fat. Many of these are toxins that are very easy for them to penetrate fat tissue. They hit the dopamine-related neurons, and the neurons basically implode, right? It's like blowing up a building. That brain cell is gone. And we see this pretty consistently with Parkinson's patients. Now, the interesting thing, though, is that if you can get a person in the earlier stages, like the patient I'm thinking about, and this woman, we'll call her Stephanie, in the earlier stages of the diagnosis, maybe like a year in, then I think functional medicine can really shine. If we can test and correct the gut dysbiosis, infections, et cetera, that are going on there, and especially clear out all the liver pathways, and even in some cases do amino acid programs to help balance the brain, we've seen really dramatic improvements.
When I came out in practice in 1980, the number of children with autism was somewhere, and I don't remember the exact number, but it was over 1 out of every 4,000. Now, the most recent numbers I've heard is 1 out of 63. Is that consistent with what you've heard in terms of the numbers of children with autism?
They're looking at old data, so the actual numbers may in fact be higher than that currently, but because when they assess them, they're looking back at data that's old. So it's definitely a growing problem. And
higher than 1 in 63?
Well, the actual rate, it very well could be higher than 1 in 63.
That's coming into epidemic. Then. That's beyond being a problem for a few.
What bothers me is that health authorities seem to be ignoring this in terms of the seriousness, because kids with autism aren't just quirky, and have a little bit of social deficit. Often they have profound immune and brain dysfunction. They're in chronic pain. I've heard the stories from many, many parents that it is not just a benign disorder of quirky behavior, which is what public authorities, health authorities are trying to portray it as now. And they're also trying to portray that it always existed and that we just are doing a better job diagnosing it. But one of the studies that was done looked at 3 possible diagnoses that could have been substituted for autism, or two other ones, cerebral palsy, or muscular dystrophy, or mental retardation. And they looked at data going back, I believe, 20 or 30 years, and they found that children who were diagnosed with muscular dystrophy and mental retardation often had complications at birth, whereas children who were later diagnosed with autism had normal births. They had high APGAR scores, whereas children with MD and MR had low APGAR scores. They had, children with autism had a male-female ratio of 4:1, whereas children with muscular dystrophy and mental retardation, it was a 50-50 split. So there were clear demographic and health differences between these populations going back for many, many years. So it's very unlikely that there was a diagnostic substitution for autism, and we're just now catching it better.
I was working with a little girl. She was on the autistic spectrum, and she was 7 years old, named Rebecca, and she's a twin. And her brother is neurotypical, which means not on the autistic spectrum. And her mom brought her into me because Rebecca was really worried because she was still wearing pull-up pants because she was peeing and pooing in her unusually, she was incontinent every single day. And then her mom talked with me for a while without Rebecca in the room, and she said, I know that that's her main concern, but my main concern is that she's a terror. She's in school, she's badly behaved. She'll go up to somebody else's desk and she'll just go like this and wipe everything off their desk. When she comes home, she terrorizes the rest of the family, and her behavior is just horrible. All we did, I referred her to her physician, and I wanted different kinds of testing, and the physician refused to do all of it. But all we did was I put her on what we call the comprehensive elimination diet. And that diet consists of fruits and vegetables and non-gluten containing grains, fish, poultry, herbs and spices, water, mineral water with a little bit of juice in it, some oils, some ghee, maybe a little bit of butter. And within 2 weeks, her behavior had calmed down because I actually lie to my clients and I say, we're gonna do this for 2 weeks. Let's just see how you do. because I know that if I say we're going to do this for 3 months, they're not going to be able to wrap their heads around it. But for 2 weeks, they can really jump in. They can do it almost 100%. So they did that 100%. And her behavior was better, but also she had only had in the last week like 3 accidents of incontinence. Within 6 weeks, she was totally continent. Her mood had calmed down. And I really wanted to do some food sensitivity testing. I wanted to do organic acid testing. I wanted to know more about what was really going on there. Yet her parents were so thrilled with how she was, they didn't even care. It's like, well, we got her where we want her. We'll just keep doing this. So the amazing thing is that when you get the right diet for the right person, it can change almost everything.
I see a lot of children with attention deficit disorder. Their parents bring them in because they've been told by the school that they need to be on medication. In fact, in some school systems, they won't let the kid back in without the meds.
Can you walk us through little Johnny? He's brought in by his parents. What happens when they walk into your office?
Well, they know that I'm alternative, that I'm not going to, that they've come to me because they know I'm not going to write them a prescription. So I take a history. What is this child eating? It's usually a boy if it's ADD. It's more common in boys because of the hormones. Testosterone tends to create more hyperactivity and ADD, but the girls as well. So let's say Johnny comes in. What is he eating? Oh, sugar pops. I don't even know what kids are, whatever the awful cereal of the day is with milk, and he may have a dairy sensitivity. So he's not getting a good start to the day. Playing video games, not playing outside enough, although there's a lot of pollution out there. But nonetheless, getting exercise, socialization, interaction with others, these are all the things that kids need. The other thing is, by the way, who said little boys are supposed to sit in school all day? If you look at successful creative people and you go back to their childhood, they were ADD, ADHD, problem kids. What were they? They were being kids. They were being boys. They were expressing themselves.
So what happens to these boys when they're brought into you?
Well, you see, my job is to help them conform, which is kind of scary. I mean, I think they should be in a different kind of school, but there aren't many schools that do that, and the public school system is what it is, so we have to adapt. And still, some of these kids do have what's called reward deficiency syndrome, low dopamine. Either they're producing an inadequate amount of dopamine, or their dopamine receptors aren't as active. There are not as many of them. And usually the father was that way, and if I take a history, and I look for a history of alcoholism, ADD, depression, anxiety, I really look for that kind of history, gambling, bipolar illness. A lot of that's related. So it all has to do with the neurotransmitter system, particularly dopamine. So when I've taken my history, I may or may not do lab tests. With kids, I'm less likely to do lab tests right off the bat, but I prescribe a healthy diet. Take out the junk, take out the sugar, take out the white flour, take all the white stuff away. Start to eat whole foods, recommending a good protein breakfast, eggs, vegetables whenever you can get them in kids, and sometimes you can't, so make a shake with greens, with fruit powder, with protein powder. They have to get enough protein. They need protein to grow. So to make muscle, to make everything. So changing the diet, adding in shakes when you can, or if they don't like the breakfast they're given, they can have a shake because it's convenient, because mom sometimes is really busy in the morning and she may have several kids and blah, blah. I had this one case, this was great. A woman came to me, she said, I don't know what to do. The school wants me to put my son on, he's 12 years old, they want me to put him on meds. I don't believe in them. What can I do? I said, here, and this was just a woman that was working in a place that I was consulting to. She wasn't even a patient. So I said, try this. And I gave her some essential fatty acid, omega-3 fatty acids, and my Focus product, which contains tyrosine, phenylalanine, and some cofactors that actually help to make dopamine. So I gave it to her and I said, take 2 Focus in the morning and 2 of the Super EPA, which is my fish oil. So that's what she did, and I saw her a month later, and she said, it's amazing. He said, what's so good is that when she went back to school and spoke to the teacher said, see, I was right. He needed to be on medication. He's doing great. End of story. That is really end of story.
Yes.
Because he did do very well.
Oh,
just
that's
doing
marvelous.
that. Because she was giving him a fairly decent diet, but he did have that reward deficiency.
That's really marvelous.
Yeah.
So functional neurology is basically a modality where you're trying to improve brain function. So whether you improve brain function through exercise, whether you improve brain function through rehabilitation, like eye movements, whether you do balance exercises, whether you do dietary nutritional interventions to decrease brain inflammation, whether you try to do nutritional interventions to increase neurotransmitter activity or
Those are nerve hormones.
yeah, nerve hormones. So all the different variables we know that can try to improve brain function is really under the world of functional neurology. So a lot of people don't realize that they have early signs of brain degeneration. A lot of people don't know that the chronic symptoms are really because of their failing brain health. So functional neurology really fits that spot between someone starting to have early brain degeneration and symptoms and doing interventions to change that around and get them to function before they develop a disease like Parkinson's or dementia, right? So there's always a transition through it, but functional neurology serves that whole where there's a need for people to get identified for their early presentation of degenerative changes in their brain and then try things that can reverse or slow down the progression into disease. So for example, someone could start to notice that their memory is not what they used to be, that they have to write down everything when they go to the grocery store, that they get lost and have to use a navigation system, that their balance is becoming poor, right?
Well, wait, isn't that just part of getting old?
Well,
like at 35 or 40?
No, that's neurodegeneration.
I know, I'm making a joke because so many of us say, oh, I'm getting old, I can't remember anymore. Really? How old are you? Well, I'm 35.
Right.
No, that's not supposed to happen.
Right, and I think that's a good point because that's the cop-out answer. The
That's
cop-out
right.
is, oh, you have those symptoms because you're getting older.
Right.
But you can get older and have improved brain function, right? So you see some of these brilliant professors, they're 70, 80, and their brain is sharp as can be, and they're still doing things and they're still active. They've actually become more efficient with their brain as they've gotten older, right? So they have what they call plasticity. Those neurons have connected and stayed healthy throughout their life.
How does plastic have something to do with brain function when you say plasticity? That's like plastic?
Oh, so in the world of neurology, they use the word plasticity, meaning that the brain can change, that the brain can mold like plastic, that
So it's adaptable.
it's adaptable.
There's new research in the whole realm of neuroplasticity that in the opportunity to begin to think differently and relate to our life differently actually has a fundamental effect on every organ system that goes on. So we know that there's a interrelationship between the psycho, mind, neuro, brain, immunology system. This work has been studied from Candace Pert and before for 30, 40 years and is an extension of Cellier's work on stress. You know, and Bruce McEwen talks about it, and it's connected to our memories and our emotions. So how fascinating is it that the brain, that what drives the whole axis of psychoneuroimmunology is our memories and our emotions.
Yes.
And if we actually have different emotional context of our memories that go on, we have the ability to change our immune system, to change it.
Yes.
Now this isn't to say it's your mind's fault. It's a practice, it's a story, it's a pattern. So how do we begin to change that story?
Yes.
So I think of last week, and I'm really frustrated. Something has hit me that, you know, someone said some things and I was just red and angry and beside myself. And I was at the Cleveland Clinic and it was time, I was gonna go get some lunch, and I go to eat, to get some food, and I was kind of nasty to the person because I was carrying this. And then I saw myself and I looked around and it's like, there's food, there's sunlight, there's people, I'm alive. I have the opportunity, there's so much to have gratitude for.
Yes.
You know, and then all of a sudden everything shifts. Autoimmunity, we're attacking ourselves. Let's stop attacking ourselves.
Yes.
And it's not about a blame, oh, you're attacking
All
yourself,
in your
stop
head.
doing this, all in your head. But we have this opportunity. And so we look at the body, we look at the mind, we look at the spirit, all these pieces together. And we have great tools now to recognize early when changes are happening. And we've got great tools as functional medicine practitioners and others to begin to make the change. And bringing all these elements together is where healing happens.
One of the things I realized was that when it came to brain, it was an area where many patients didn't really have any options. And a lot of them suffering really had early signs of brain degeneration, or had a traumatic brain injury, or there were children that were having developmental delays, so their brain wasn't developing in the right stages. And it's such a profound impact on families and loved ones. And it's one of these things where it can be dramatically changed if you just do some interventions. So it's very easy to get very excited about functional neurology, because you can really help so many people that don't usually get helped by it. It's an area where both alternative and even the conventional medicine have really not jumped on top of, right? They really haven't really looked at how to make the brain reconnect through activation. There's some general nutritional guidelines for brain, but there's so much more that people can do.
And is it, as my experience was here today, that with most of the exercises that people can see changes relatively quickly?
Right. So for example, and for brain, it's really simple. Whatever you're bad at is your brain exercise. So if you have bad balance, you work on your balance. If you have bad with numbers, you start doing numbers. So that's really the premise of trying to reactivate the brain and make it reconnect. The areas that you have inability to perform, or the actions you can't do as well, isn't because of a personality issue. It's because those areas of the brain are not integrating and working properly, right? So if your handwriting all of a sudden gets terrible, that means areas of your brain that control your fine motor movement are starting to degenerate. So maybe working on your handwriting could be a really great thing, right?
And there are some exercises that would help activate that area of the brain for fine motor movement.
Exactly. Right, and it could just be the simple task that they're not doing well. And what people usually do is, well, I'm not good at this, so I'm going to totally avoid it.
Yeah.
I'm not good with numbers, so just have someone else do it for me. But they don't realize when they act that way, they're only promoting their degeneration faster, right? So you really want to do things that you're becoming worse at or losing function in, and trying to keep those areas of the brain healthy. So that's the easiest way. Someone that's just listening doesn't have someone to examine them and give them some specific therapies, can really look at things that can dramatically help themselves just by being more observant.
I work with parents of children who are at risk of going on psychiatric meds, working with them with diet, nutrients, and lifestyle to how to avoid doing the psychiatric meds.
Wow. And have you seen transformations happen when people take the right protocols?
Absolutely. Absolutely.
What's that look like? What happens?
I'll tell it from a personal standpoint. My son has been working with a protocol, a nutrient protocol, that where he has gone from taking one very, very strong psychiatric med to a much lesser one of less potency, I suppose you could say. And he is on a nutrient protocol where he is now present. That may be difficult to understand for people, but sometimes when you're on a psychiatric med, you are zoned out, not quite all here. And now on the nutrients, he's very here, he's very present, he's very capable. He could live a perfectly normal life, I feel. And yet the missing piece is still the gluten. That is a piece that he's not accepted, so he continues. And I feel that if he could finally add that piece to the rest of the nutrient protocol, he could really do anything. So.
And how does that feel as a mother to see that transformation?
Oh, it's hugely wonderful, of course. And as a mother, I think you see a child from early on and what their gifts are. And as you see those gifts perhaps become masked or diminished, and then to see them reemerge is huge. I feel that he's an immensely gifted person. Gifted doesn't mean a geek perhaps, but he is intuitive and he's very, very smart. He has a memory to beat all memories. I call him when I can't remember something, and he remembers the most obscure things way back. And just being able to realize his passion, his joie de vivre, his life, his being is wonderful. So that's what it would be.
In the presentation I gave, we randomly selected. We did not just look for patients that were positive. We randomly just, oh, there's one, there's one, there's one, there's one. We randomly selected 118 patient specimens that the healthcare practitioner had ordered our comprehensive tissue antibody test simultaneously with at least one of the 3 food panels that we offer. And then I culled the data to see whether they were positive or negative to IgG, gluten family proteins, and also for the dairy, I did that as well. And then whether or not they were reacting to their tissues. For the gluten family proteins, I believe the number was 63% of the patients who make antibodies, IgG antibody to gluten, not IgA. This is not celiac disease. This is non-celiac gluten sensitivity. 63% were made antibodies against one or more of their tissues.
So 63% of the people whose immune system was fighting wheat, fighting a gluten protein of wheat, 63% of them also had elevated antibodies fighting their own tissue. It might be the brain or the heart or the lungs or the liver. What was the most common tissue?
The most common tissue was the neurological tissues, 4 different neurological tissues involved, but they were reacting to, that was the most common target, was neurological. The next was adrenal, number 2, and number 3 was heart.
Wow.
So that's pretty serious.
Actually, there is a great connection between our intestine and our brain. And I will tell you a story that happened to us, that we have analyzed patients with multiple sclerosis, which is a classical autoimmune disease which affects the brain. And when we have analyzed these patients, we have found that 8% of them, 8 out of 100, they had antibodies to gluten. At the beginning, we wanted to neglect this information. But then looking in the literature, we have found that there is a cross-reactivity between the gluten structure and a structure in our brain, a molecule. It's called, if I remember well, synaptosome or something like that. And what happened when you eat gluten, which is foreign to our body, you develop autoantibodies against gluten. And in those individuals who are genetically prone to develop multiple sclerosis, these antibodies may cross what we call the blood-brain barrier and attack the brain. So it's very interesting. Let's recommend those 8% of multiple sclerosis patients who may have the anti-gluten antibodies and avoid gluten from their diet. It might help. It might not help when the disease is already full-blown, because, as we say, the horses already left the stable, but it might help.
I have a patient that this reminds me of.
Yes.
And she came in and I said, well, what's your problem? She said, well, I'm a wheat tard. I said, you're a what? She said, I'm a wheat tard. And I said, having never heard this term before. Yes. And I said, well, what happened? She said, well, I get the slightest bit of gluten, I go into like a catatonic state and I become unresponsive. I start to drool and my body, my family has to carry him around. So they call me a wheat tard when I do that. And I was like, you've got to be kidding me. And until I saw her mother and her husband and everybody, oh yeah, this is real. And the slightest bit of contamination immediately caused this neurologic response in her. And even when she was blinded to it. So I think there's a lot of mysterious interplay between our environment and our brain. And certainly much of this seems to have a connection with our immune function. We're not sure how sensitive she is because she monitors her world as closely as any celiac disease patient should. Mm-hmm. And so her ability to be well in the rest of her life depends entirely upon her actions now, because this is not just a symptom, This is a symptom of neurodegeneration for her. And that's where people have to recognize that symptoms matter. Symptoms are early warning signs that there's damage happening. And when these are neurologic symptoms, you don't mess with it.
Right.
Because this is your brain. Your brain determines your quality of life. If you lose neurologic capacity, by definition, you are less of who you could be.
One of the things we know is that with certain autoimmune diseases, there are certain proteins the immune system attacks. So with people that have something called neuromyelitis optica, where they have inflammation against their pathways of their vision.
So the wires that come to the eye to help see,
Right.
the nerves that come to the eye.
So there's a receptor there called aquaporin, and it's this receptor that allows fluids to cross, this, hence the name aquaporin. But there's foods that have aquaporin proteins too, like soy and tomato and spinach. In the world of immunology, there's a concept of molecular mimicry or cross-reactivity where each of these proteins get broken down to what are called amino acids, and there's a sequence of them. And if the sequence of them is similar enough, then the immune system can react to that food and make those antibodies, but those antibodies can then attach to the same protein in our body.
So the analogy I like to use for people is if you think of proteins like a brick wall, and all the bricks are the same size, but they might be different colors and there's different designs on how the wall looks. And when our digestion is supposed to break down each brick of the brick wall, and those go into the bloodstream as amino acids. But with gluten as an example, we can't break down that protein completely, so we break it into clumps of the brick wall.
Right.
And some of the clumps of the brick wall can be 6 or 8 amino acids or more that look identical to some of our own tissue.
Right.
And so when the body makes the antibodies to the gluten, the 6 or 8 bricks, and those antibodies are going through the bloodstream looking for the 6 or 8 bricks of gluten, they see the aquaporin channels in the eye, in this example, and they start making the antibodies against the aquaporin in the eye.
Exactly.
That's cross-reactivity?
That's cross-reactivity.
And so you said spinach and tomato and what else?
Soy.
And soy.
Yeah, those are the major ones.
So people,
for that target tissue only,
Mhm.
for aquaporin-associated autoimmunity. And that's what we're learning is that different foods have different autoimmune potentials based on their amino acid sequence to different tissue target sites where the immune system is attacking. So certain tissues in the body are very similar in the amino acid structure to certain foods. So if you eat those foods, make antibodies, those antibodies can then attach to that tissue and then cause this destructive process. And it happens with brain autoimmunity all the time too. So there are foods that can do that. And recently we did a 220 food screen for cross-reactivity with the cerebellum because we knew it was more than gluten. So we found a list of 25 new proteins that can actually have molecular mimicry with the cerebellum. And the one that was off the charts was yeast and rice. Which many people eat on a gluten-free diet.
Wow.
So we know that certain people that have, for example, gluten-based neurodegeneration or autoimmunity called gluten ataxia, they may go gluten-free but still get exposed to the rice and still have a reaction.
Right.
And even things like peanut butter peanuts were cross-reactive to that tissue. So as time expands and people start doing more research, we'll be able to pinpoint certain food proteins that are triggers to areas of the brain.
So as background information, bread contains a number of components. Wheat has a number of components, not just the gluten proteins. There are the lectin proteins, and those are called wheat germ agglutinins. There are the wheat amylase trypsin inhibitors. There are the gluteomorphins. There are families of proteins in wheat, not just gluten. And what you're referring to is one of those other proteins of wheat, the wheat germ agglutinins. And 76% of people that had elevated antibodies to wheat germ agglutinins also had elevated antibodies to their own tissue. And it's a different mechanism. It's not because it looks similar to the food that the immune system was attacking, but rather the wheat germ agglutinin grabs onto your brain tissue or your blood vessel tissue, and then your body is trying to destroy the wheat germ agglutinin, but the collateral damage on the cell damages the brain tissue or the heart tissue or whatever it should be. What else did you notice in your studies on this?
Well, again, in all three of the food groups that were included, the number one target was the nervous system tissues. And that includes myelin basic protein, MS. That's the target in MS. Cerebellum. Do you want gluten ataxia? Do you want cerebellar ataxia? No, you don't. You want to be able to walk erect and without canes or anything like that.
Let's just talk about what ataxia is, because that's a term that we've heard in interviews here. How do you define ataxia?
I don't really have a definition of ataxia. Ataxia it's a movement disorder where your cerebellum isn't sending the signals correctly, and so you're unable to send those signals to make your legs walk or work properly.
Right,
so you
right.
can't walk.
Just like if your brain doesn't work well, you think, oh, I'm getting older, I don't remember the way I used to. It can be just a mild annoyance, or it can be very severe, you don't remember anything, and you have Alzheimer's, right? It could be anywhere on that spectrum. As I understand ataxia, it's the same way. How many elders can dance up and down the stairs? Then not many, because they've lost the connection from the brain to the muscles, that not lost it completely, but it's diminished, so they're always cautious about walking. They're always cautious about losing their balance or falling. That's a form of ataxia in a very mild level. And the severe is when they really can hardly walk at all, and they, as you say, they wander or wave back and forth. So anyone that notices that they're having to grab a rail when they're walking downstairs, you might want to consider being checked to see if you have elevated antibodies to your cerebellum, that it's so commonly a culprit for seniors these days.
When you see your child turn the corner to more wellness, you'll realize that the quest here or the efforts that you make are well worth it. There comes a moment when they truly are healthier and grounded and able to form their own thoughts better or apply themselves in school or with life, whatever that is. And that's, I think, our ultimate goal as a parent anyway, is to help them realize their gifts. And that's the most important thing.
You believe that we need to help them find their gifts, find their voice?
Absolutely. I don't think children are ours, so to speak. I think that they sort of come through us, whether it's even in an adoption or as a birth child, and that's basically our role, is to help them realize their gifts and help them go out from us to be the best person they can be in the world.
And you know what it's like to see somebody robbed of their ability to just experience and appreciate their own gifts.
That's the biggest heartbreak to me, is not being able to experience their gifts.
It's not right.
It's very not right. And I think the hardest part as a parent is fighting the good fight, in essence, against the world, because so many other people don't understand it. So many people will say to me, oh, everybody says it's a 20-80 principle. There you can have gluten 20% of the time, and if you're good 80% of the time, it's good. That's the general thinking. Well, it's absolutely not. It has to be 100% of the time. And so vigilant that you're making sure everything is gluten-free, and when you go to a restaurant that you're taking the special enzymes to enable you to bypass the little tiny bit of gluten that's in a food that you might eat.
Have you seen rheumatoid arthritis patients come in for emotional or cognitive complaints?
They're coming into me for that. They're coming into me for their psychiatry consultation.
Yes.
They have the rheumatologist.
Yes.
I said, well, what else do you have going on? Oh, and I'm looking at their hands, and
yes.
Their hands do not look very good. They look like they have rheumatoid arthritis. Oh, yeah, well, I'm seeing the rheumatologist. I said, well, would you consider, let's look at your diet. Let's, again, test whatever, and it works to actually remove the offending foods, treat the way I treat, which is a functional medicine approach to rheumatoid arthritis, they came to me with depression.
Yes.
And you'd say, oh, well, yeah, they're depressed. Let's help them adjust to their life situation. No, the depression went away. I mean, this happens. When I say a case study, there's more than one case where this has happened.
Yes.
And people come in with all kinds of really difficult issues, Crohn's disease. And again, let's look at what is causing the Crohn's disease, not like let's treat Crohn's disease with the GI person and the psychiatry, I treat the depression. It doesn't work that way.
Yes.
We have to treat the whole person. Well, what's interesting is that many autoimmune diseases present as a psychiatric condition. So they've come to me, I'm the psychiatrist, and if I were a regular psychiatrist, I would write them a prescription. Oh, you're depressed, here's a prescription for, an antidepressant. Or, oh, you're bipolar, here, I'll give you all these medicines. Instead, I do a complete workup, I take a history, I find out if there are any other organ systems out of whack. I will look for thyroid antibodies, I'll look for the gut being out of order in any way, leaky gut and so on, food sensitivities, and I uncover a tremendous amount. And then, it's not being a psychiatrist, I'm being a full body physician.
Yes.
Which is really what psychiatrists ought to be.
Yes.
I mean, I went to medical school and I learned a lot. And what I find is that most psychiatrists just throw that away and they're just dealing with writing prescriptions. And that's because that's the way it is. That's the standard of care. I can't really blame individual psychiatrists, but it's not a good way to practice psychiatry.
That's the way that they were trained. I'm assuming that's the standard protocol. Is if someone comes in with depression, here are the antidepressants you might consider based on the individual.
Yeah, it's seen totally as from here up, and it's treatable with a magic bullet.
Yes.
And of course, the medications are fraught with problems.
Yes.
What's really wonderful is that the amino acids, vitamins, and minerals that we give actually address the problem more directly, and we get really faster results because the antidepressants really take weeks to work.
Yes.
And a lot of it's placebo effect, and that's kind of led by the side effects. You have a side effect, you're feeling nauseous, or all of you have stomach aches, headaches, so many things happen, so many side effects can occur from the medications that you think, oh, it's really working, and you believe you're having an effect. But if somebody is anxious, not sleeping well, kind of wired and anxious and depressed, they have a serotonin deficiency. So what do? I give them 5-hydroxytryptophan or tryptophan with some cofactors like B vitamins, particularly B6. Give them some magnesium because that chills you out too, and it's also good for depression. So giving these amino acids and other nutrients in the right amounts and building it up, you can build them up pretty quickly. It works.
Yes.
They feel better. So I don't have to turn to medication much of the time. And people that are really, really, if they're seriously manic, they're going to go to a hospital, and they'll be treated there, unfortunately. And I've had to take people off of meds after they've gone in the hospital, been put on very high doses of medication. They come out like zombies, and then I have to do the work of helping them to gradually get off the medication, well, as quickly as I can. But you can't get off medication quickly because it causes other problems.
And autoimmune disease is so important of a condition to address this.
Yeah.
Because you think about the root cause, the root thing with autoimmune disease is body attacking self, right?
Yes.
And what I've found is there's a lot of patients with autoimmunity that have poor self-worth, or they are sabotaging their own health, not knowingly, not meaningfully, because they are afraid to be their best self.
Oof.
Or they're afraid. I can tell you personally, Tom, when I think about the gut diseases, Crohn's disease, I suffered with that.
Yes.
A lot of it is fear-based.
Yeah.
I feel like I'm on the other side of that, but if I look back at myself at 25, I had a whole lot of fear. I had fear of success. I had fear of everything. I lived in fear, and as I conquered that and overcame, the gut is the center. You talk about a gut feeling, or we're nervous, we feel it in the gut.
Yes.
The gut-brain connection is so powerful, and when we have fear or anger or any of these emotions that are harmful, and we lack the hope, it can cause disease. It can cause autoimmunity.
Yes. Wow. So wait a second. Louise L. Hay? And
Yes.
Yeah. Okay.
Yes.
Heal what you can feel, or yeah. So one of the things
that she talks about is, being at home, right? Feeling at peace with who you are. And she's always doing these affirmations to remind people, bring it back to loving the self.
Yeah.
And what I'm hearing you say is people doubt themselves, people have fear. You had fear in your condition, you think it was a contributor. So it's as if you're not comfortable with your own self, you accept your own self, it's almost like you're sabotaging yourself, which that's exactly what the immune system is doing.
Yes, yes.
There's something about the self that it's not comfortable with, and therefore it attacks it. That's interesting. We're on two different levels with this.
Yeah.
And then if we go into what you're talking about with science, right? You're saying, I love the science facts. I love all the little tools. I love learning the details about the microbiome. I love learning the details about the endocrine disrupting chemicals. I love learning the details about the mold. I love all those little pieces to kind of put this picture together. But at the core of all of this is a whole human being, not little teeny factors everywhere.
Right.
It's this one person who, through their own belief in the healing process, we can build a foundation. And then with all the little pieces, we can pull in the tools of changing the diet, we can pull in the tools of lowering the chemical exposure, we can pull in the tools of changing the environment they live in with the mold or the water they're consuming. And then from that foundation and cleaning up the rest of the stuff, then we get the disease to start dissipating. Is that about right where you're coming from?
Absolutely. Yeah, you have to look at that patient at the core as a soul, as a person that's more than their physical body. And if you look at that, that's the core. And all these other are physical manifestations of the core. So very powerful. And I address the toxic chemicals and the mold. Did you know mold raises TGF-beta, which is a potent driver of Th17, which is a potent driver of autoimmunity. So these are like critical factors that you address. Like if they're living in a moldy home, they can be happy all they want or think hopeful thoughts and joy, but they're not going to get well. So you have to address both at the same time.
I'm a guy, and I'm thinking, I'm not going to expose my inner feelings out here. I don't want anyone to know this. How do they deal with that? What do they do?
Well, deal with it.
That's right, exactly right, exactly right. Deal with it.
Because you know what? We're all human.
We
all suffer. We all have feelings.
That's
and if we break down those barriers and we start to share and connect with each other, we realize we're all the same.
Yeah,
and there's nothing to hide.
We feel safer like this in life, and I'm exaggerating, but that's what we're doing, and we might close our chests off in life. But I'm going to suggest take this on 20 minutes a day, write down, just journal, and then if you're concerned, burn it so that no one ever sees it, right?
That's a good strategy. You have a little pot outside in your backyard and stick it in
there. There you go. I remember the story of Abraham Lincoln during the war, that his generals that were complaining about each other one-on-one with Lincoln, and he said, write down exactly the letter about how bad a person this is. Write it down right now. Sit down, write it down. And he made him write it down, and then he said, now, burn it. Now go talk to that guy, right? And so get it out, let go of it, and then get rid of it if you're concerned about being exposed. Right? But still, they're doing the exercise, they're starting to let down of the emotional breaks that they've got on.
To allow yourself to feel in your heart, what am I feeling? Does this feel like there's truth in what is emerging for me? And if it feels like this is something that I want to investigate, then there are ways to be able to find clinicians, nutritionists, health coaches, a whole array of healers who are embracing a view that includes functional medicine and is even bigger than that. That is, how do we begin to help?
I have the opinion, and I call this my field of dreams opinion, that if you build it, he will come. That if you declare, I would like to have a more open mind of gratitude. I would like to appreciate my life more and not be so caught in the day-to-day, that if we just declare that to ourselves, that then you start the momentum. All roads lead to Rome, but you got to take that first step, right? So I think that's one way that I have tried in my past, and it's helped me. But for many people, this is the first time they've heard something like this. And maybe it resonates a little bit. I just want to encourage everyone to take the first step, just baby steps in that direction. Explore it for yourself. one of our guests talked about journaling, just writing down what your thoughts are on this or about your health issues. And if you have a concern about the privacy, that you're willing to entertain it for yourself a little bit, but you're concerned about the privacy, then you do what I call the Abraham Lincoln principle. That during the Civil War, a couple of his generals would just badmouth each other when they were with Lincoln separately. They would talk about this guy, and when this guy was here, he'd talk to Lincoln about that guy. So what Lincoln did with both of them was he had them write down the nastiest letter that they could possibly come up with about that person. Right now, with Lincoln, write it down. Write it down. I'm not going to read it. Write it down. And they'd write it down, then he'd say, now burn it. And now you've burnt it, and now, but you got it out, right? So for those that are hesitant to journal, write it down and then burn it. You know, do whatever you feel safe, but get it out of your head and let it start to flow.
Yeah. Another form of ritual, of being able to do that. And you talked also about it's in the communication, it's in the connection.
Yes.
So doing that, connecting to others, being able to share, let the emotions move forward through you, let them be expressed, and then they'll move and they'll change. When we watch a 3-year-old, they move through emotions very quickly. They don't hold on to them. You know, learning to begin to do this. And also, as you were talking, the other thing that arose for me is a simple practice, is a simple gratitude practice. And so when you go to bed each night, is to simply say, what are 3 things that happened today that I'm grateful for? Some days you might only think of 1.
Yeah.
But to do that, to allow yourself to connect to that at the end of each day. Not what did I do wrong, but really to connect to gratitude and be able to move into that state.
I think the thing that gets in the way the most is ego. And so as we humbly come, to me, it's back to that gratitude. When I have a patient sitting in front of me, I truly feel love and gratitude that they are allowing me into their lives. And so often in the clinical setting, they're revealing very personal details. And what I want for my clinic to be is a place where people feel loved and they have hope. And for me, I'm grateful because every person that comes in, I have this opportunity where they're letting me into this window, this intimate window into their lives. So as I have an open heart, it really feels like that is what allows me to hear. And I think so often, right, that it's listening, it's hearing, and hearing with that heart that's open, full of gratitude and love.
Yeah.
We literally tell our staff, your job today is to love people. That's it.
Oh,
That's
yeah.
it.
Yeah.
It's so simple. And the healing starts with that belief that they can be well. So
Yeah.
if we instill that, and I still do the testing, the science, I love the science.
Yeah.
But that underlying current of love and gratitude are what I think opens the healing connection. Because we know the most powerful effect is the healing is the brain, the mind. There's recent studies I've just been reading about in Joe Marchette's book, Cure, I believe it's called.
Yeah.
How if you add a placebo to a drug, for example, immune modulation, so someone who's had a kidney transplant needs to have the immune suppression, or
Right.
they'll reject that kidney.
Yes.
And those drugs are very strong and strong
Yeah.
enough to cause horrible side effects.
Yes.
So what this experiment did was they added a green drink that was very, potent smell and
Yeah.
color
Yeah.
to the drug.
Yeah.
They did that, every month. They did the drink and the placebo. And then what they did is they had half the dose of the drug by half, basically.
Yeah.
Gave the green drink, still worked the same, and then they stopped the
No
drug.
drug, just placebo.
Just the drink, same effect.
Oh my gosh.
So what we find is this mind is so powerful. And what's so important for me as a clinician is I love the science. I will never ever give up the research and the data and the
Yeah.
testing.
Yeah.
But this is in addition, and probably more powerful than the science, is to give that patient hope and allow them to believe that they can get well.
Oh my gosh.
I believe that there's no doubt that I have had breast cancer, I've had Crohn's disease,
Sure.
and even since then I've had some health issues. And the one thing more than any other drug or nutritional intervention that I have going for me is I believe that I will be well and that I can get well.
Yes.
And then when you can teach patients to have that as well.
We have been looking at vaccine ingredients and vaccine preparations because in my own research as a mom, I discovered that certain vaccines and certain vaccine ingredients had not been tested as rigorously as they ought to have been. I went to an FDA meeting where the question was asked, where are the safety studies on aluminum? It's in many vaccines that children are receiving today, and aluminum has the potential to be neurotoxic as well as impact the immune system.
That means the brain, toxicity to the brain.
Yes,
right?
yes. And we've certainly seen a rise in all kinds of disorders in children affecting their cognitive function and motor skills and social function. And I felt that if the FDA wasn't going to test it out, that if we were going to be putting this substance in our bodies, we ought to know what is it doing to us. So we've primarily focused on aluminum adjuvants, but we've also looked at aluminum in food. We're doing a feeding study on aluminum in baby formula because most people are not aware that there's quite a lot of aluminum in baby formula.
Is there? I wasn't aware.
Mm-hmm.
Where does it come from in the formula?
We're not certain. The manufacturers say it's an artifact of the packaging, but many of the ingredients are assembled from foreign countries. This ingredient may come from China, this one may come from another country, and there's not really a lot of quality control, so it's unknown what they might be adding. And aluminum can be used as an emulsifier to make it so that powders will mix easier and not clump. So we believe that it's possible it's being added to a constituent ingredient before it is formulated for that purpose.
Isn't there aluminum in baking soda?
You can buy some that's aluminum free, but yes, there's that was a source of aluminum for a long time. Baked good mixes are often a source of aluminum.
Mm-hmm. Mm-hmm. And what have you seen in the studies that you've looked at that in terms of the impact of aluminum? Is it that our government agencies are ignoring this component of aluminum and they're not considering it to be a toxin?
Despite the fact that there's about over 900 studies showing that aluminum is neurotoxic, toxic to the brain, they have not felt that there's any need to study this. They believe it is a necessary evil, a necessary ingredient in the vaccines. And we believe that there are other adjuvants that could be used. And certainly anything that goes into our children's bodies ought to be rigorously tested and proven safe before giving it to the most vulnerable among us, infants and young children.
I believe that there were limited and inherent risks to vaccines, but I believe that those risks were well calculated and that the benefits certainly outweighed the risks of, and that serious harm was not possible. I took a hiatus from my writing career. I was a magazine writer, and we moved to the UK, where I was contacted by our doctor's clinic to bring my children in for the meningitis C vaccine. This was not on the Canadian schedule, but it was on the British schedule. And I, at the time, sort of questioned it because it wasn't on the Canadian schedule, but there was a sort of a campaign of awareness about meningitis that I now recognize was sponsored by the drug company selling the vaccine. But I was concerned about this. So I brought my eldest children, my identical twin sons, Joseph and Patrick, into the clinic in May 2006. And as it happens, though they're identical twins, Patrick is a little bit smaller and had some heart trouble at birth and interventions. And he was sort of feigning illness on the day. And as a mom, I was just thinking of the post-vaccine sequelae, the fever and achiness and things like that. And so.
And how old was he at that time?
They were both 10.
10.
Yes.
So he's feigning illness
well,
when
he's
supposed to go for a shot. That's a smart kid. You
know? he didn't want the shot. And,
yes.
And I recall actually that the health nurse looked at me like, you are such a sucker. And I just said, okay, we'll reschedule him. Because I just didn't want two kids feverish and achy after this. I thought, well, I'll delay him. And so I didn't realize on that day in May 2006 that I was leaving that doctor's clinic with a case study and his genetic control. And my son Joseph, who received the vaccine,
You're a little bit stronger, healthier
he's
son.
the strong, healthy
Yes,
boy.
he received the vaccine.
He received the vaccine. And within 3 days, he was ill. Now, I just thought this was a sore throat, swollen lymph nodes. It was a visibly sore throat, but he developed, he was treated for a double ear infection, and he developed headaches that became worrisome because kids don't get long-lasting headaches. And it was a full week before I realized that it was connected to the vaccine, because he suddenly, he was shielding his eyes from the light, and he was lethargic and fatigued, and it was just you know, that's the question they ask you about meningitis all the time. You know, look at the light, and I was horrified. And then began a lot of doctors' visits over months because of these persistent symptoms. And what these symptoms were headache, fatigue, joint pain, light sensitivity. And the most worrisome things for me as a parent to see were the psychiatric symptoms. Those were absolutely terrifying because he was hand-wringing. I woke in the night to find him walking downstairs alone in the night, a 10-year-old. He was sleeping through the night for years and suddenly was unable to sleep. And a little boy who had gone from a joyful, robust, happy-go-lucky, sanguine kid to suddenly listless. The school calling me to bring him home from school. He was asleep on his desk. And depressed child. It was crushing. It was absolutely crushing. And what was the second most horrifying thing was that the medical people we were dealing with, doctor after doctor, was completely blind to the connection with a vaccine, an injection, you know, hours before the onset of illness.
The Asia syndrome comes to put under one umbrella many of the things that we have talked today, and especially those diseases, autoimmune conditions, which are induced by adjuvants. And adjuvants, in this respect, refer to those substances which ignite, accelerate, and stimulate the immune system. And as I mentioned before, in those who are prone to develop autoimmune disease because of the genetically hyperactive immune system, will develop autoimmune disease. So ASIA means autoimmune syndromes, all the 80 different autoimmune diseases, induced by adjuvants. And it refers to those diseases and those individuals in which some vaccines, which contains the adjuvants, will induce the autoimmune disease. The idea of describing and giving criteria of diagnosis to this syndrome was to attract the attention to their existence, because still we are brainwashed with the idea that vaccines are always innocent. They cannot cause autoimmune diseases. Still, I'm not against vaccine. I'm a pro-vaccine. But we, the physicians, should be aware that in some individuals, if it is in a close proximity and it has the plausible mechanism that we have discussed, they can cause it.
Eventually, a pediatrician scanned his brain for plaques that are associated with acute disseminated encephalomyelitis. It was the first time I had heard about ADEM as a parent. And ADEM, I learned, was a known and documented risk of an adverse event associated with virtually every vaccine. But it was something I had never heard of, having given all of my children vaccines. And I was horrified that parents are not informed of these these known risks that are associated with vaccines and known serious risks associated with these are neurological consequences that can put a kid in a wheelchair for life. It's a precursor to multiple sclerosis, perhaps. I then also discovered, autoimmunity. And that was an absolutely terrifying concept to me because we have this incredible immune system. I mean, this vast and complicated network that is so sophisticated. This is the most sophisticated national defense system in the world.
Yes.
And this can train on your child, on a part of your child. And the concept to me was new and completely horrifying because it was the first time that I put this together with vaccination in the context of ADEM. And of course, as I began to research into the particular vaccine, I was uncovering incredible things. That vaccine had been, as a journalist, I was looking at this, just saying, there was 4 out of the 5 doctors who approved the vaccine, was reported by the Observer a few years earlier, had been in the pay of the drug companies. It was reported in the Independent a few years earlier that the manufacturing plant producing it had been sanctioned for egregious violations of safety, although it continued to produce this vaccine.
Wow.
A child had died following the vaccine. A 13-year-old boy had dropped dead on the soccer field 2 days after the vaccine, and there was not another word about it in the press. And as a journalist, as an investigative journalist, an award-winning investigative journalist, I was looking at it and saying, where's the spotlight team on this story?
Yes.
The acquiescence of the media in this, their silence, speaks to larger forces at work.
Yes.
In this. And
not only that, but that legislation is now passed that if there's a side effect to a vaccine, the person can't go back and sue the manufacturer of the vaccine.
Absolutely.
Yes. That's how powerful the
Yes.
movement is to keep this quiet.
Yes.
Many of the vaccines may work, but if the benefit does not outweigh the risk, then we should rethink and re-envision how we implement our mass vaccination system. We need to do a better job of figuring out who is most at risk and who may be most at need for the vaccines versus which populations may not need as many. In many countries, vaccines are optional, but in the United States, they're mandated. And so parents have more choice in many countries around the world. Why don't United States children have more choice? Mm-hmm. And despite the fact that they have choice, we're not seeing rampant epidemics of diseases the way we are made to believe that we would have them if we had choice. And in part of my research, I reviewed vaccine policies from countries all over the world, and I found almost all countries only recommended the hepatitis B vaccine if the mother tested positive. So they were using wise, medical care in treating, and caring for these children and trying to protect them. Whereas we're giving it across the board and not even taking into account who is getting harmed. We're not counting, we're not looking for the harm.
Yes.
And we just need to do a much better job of doing rigorous science before we make these recommendations, because it's more than just the toxic ingredients, it's the culture mediums. There are vaccines cultured on insect culture. What happens if some of the insect proteins end up in the vaccine preparation and you're injected with a vaccine that might cross-react with after you get a bug bite? These are things that are all unknown, and we need to do a better job of rigorously testing and proving safe.
Well, aluminum, it's the most, it's been approved by the FDA with a vaccine, not alone. But with a vaccine, it's been approved in several vaccines, and hepatitis B, HPV, vaccines, flu vaccines have aluminum, either with different minerals, but it's aluminum. What you see is you give it to patients and it can persist in the body, like you give it in a vaccine, but it can persist in the body for up to 8 to 14 years, 8 to 11, 8 to 14 years. And then you see it passes the blood-brain barrier, and you see it can elicit autoimmune responses. What you see is that aluminum is not part of our body. It's not a common, it's not a protein. It's nothing, you don't have it.
Yes.
That's why your body is alert when it comes into and when it's inoculated as a vaccine. It alerts your immune system and it says, "Hey, something that's not here.
This is not supposed
this
to be
doesn't
here."
belong." Yeah, this doesn't belong. So if it doesn't belong, you need to go there and see what it is, and try and take it away. But it can't. So it stays. And you have a specific disease that has been described, which is macrophagic myofasciitis, that has been shown when you do a biopsy, all the patients have aluminum deposits, and it basically you have pain in your muscles, and you have an inability to do everyday chores. It's very.
There's an inflammation in the muscles.
Yes,
that
an
occurs.
inflammation. Yeah, it's a morbidity. You don't have mortality for it, but you're bad. you don't feel well.
You don't feel well at all.
You don't feel well at all. So it has been described, and it is associated with aluminum. We've seen that aluminum is toxic as a molecular basis for cells. So it's not ours. It doesn't belong with us, and it stays with us for a long time.
The vehicles of the vaccines, nowadays they don't use mercury, for example, but aluminum.
They don't use mercury, but they've moved to aluminum.
Yes, into aluminum. This is a problem also, because you are putting strange things that our immune system don't recognize. And they can achieve a lot of aggressive inflammatory response to the muscle, to the joints, to the kidney. That is the ASIA syndrome.
The ASIA syndrome.
And we have to be aware of that, and to be aware to not to vaccinate some kind of patients. You have to be the balance and the risk of vaccination those patients.
How do we evaluate the people or the children who might be more sensitive to the components inside the vaccination?
I really don't know.
Yeah, that's a big question nowadays, isn't it?
Yes.
So if there's a family history
yes.
of autoimmune diseases, might that be suggestive?
Yes. I think we are having more problems with some vaccines you are not giving in the childhood. Not the vaccines of the tetanus, the diphtheria, yellow fever, and things like that. You are given in the national programs you give. There is no much problem, because most of them are going to be done in the first, second year of life with an immature immune system. The inflammatory response will not be so big, so aggressive. Have some fever and some rash. Not more than that. But in adults, there is a different problem. Okay, and that is a problem a little bit with hepatitis B vaccine, even the tetanus vaccine, yellow fever, and vaccines for the third world countries. Okay, that you are going to make every 10 years until the end of life if you are going to travel. That could be a problem. And the ASIA syndrome is more for that kind of problems, not so much to the new vaccines in the 1-year-old boys or girls or 2 years old. It's not the same problem.
When my son, post 6 months vaccine, he was diagnosed with chronic fatigue syndrome, and he was referred to a London specialist, and we were then offered antidepressants for an 11-year-old boy, or the option or option of painkillers that were described to us as experimental. And so I said, we had already begun searching outside of the box. We consulted a nutritionist. He had a hair sample done, and that showed that he was, his magnesium was through the floor. His zinc was very low. That made sense to me. I had been reading about aluminum in this vaccine. I also learned that this vaccine had not been tested on his age group and is not offered currently by the NHS to his age group. So my son was a guinea pig.
Yes.
And then we put in the magnesium. We had that confirmed, that hair result confirmed both privately in blood tests and on the NHS that his magnesium was low. And so we started him on some nutritional supplements, and we saw wind in his sails and a smile.
Wind in his sails.
Wind in his sails and a smile on his face. And the magnesium made so much sense to me because it explained so many of the symptoms, the anxiety that we saw, the twitching, muscle twitching. And we saw our son return, and it was a sense of great relief, and we made it through that one. And by age 14, he had episodes of migraines and fatigue, riding his bicycle up the hill. And again, all of the old worries resurfaced. And these now I've learned would be called the bridging symptoms. And then when he was 16 years old, he came home one day from high school, and he was playing the piano, and I noticed he had gone to the barber, and I noticed on the back of his head a round spot like that, and I was like, what is that? And he said, oh, the barber says it's alopecia. I had never even heard of alopecia before. It's a rare disease. So I took him to the doctor, and the doctor said, well, it's probably just stress from the exam time or something, and it's genetic. And I said, no, it's not genetic. His twin brother, his identical blood-tested twin brother, does not have this, and it's his immune system. He said, oh, well, it'll probably just go away after the stress. And within a few weeks, he lost all of his hair and his eyebrows and his eyelashes. And to me, this is evidence of children being, used.
I get emails and letters and calls from parents all the time with terrible, serious health problems that their children are having that no doctor has been able to figure out any way to relieve the child's symptoms. And the children are suffering terribly. And we're seeing diseases that in children that we've never seen before certainly not when I was a child. And that you can always decide to vaccinate, but once you've made that decision, you can't unvaccinate, if your child was harmed by a vaccine. So it's really important to do your research, to be aware of what the signs are of an adverse reaction, and that if your child is reacting, to get appropriate medical care and to do your research and make wise choices. I think there's a lot of choice that's up to parents that they may not realize, and that they should take advantage of learning about what's in the vaccines and using what they've learned to protect their children.
And I started listening to everything I could on autoimmunity. Celiac disease is a model of autoimmunity. I was just trying to absorb everything I could. And I heard that there was this autoimmunity congress in Nice, and it was a few weeks from when I was listening to it. And I saw the lineup on the schedule, and I was like, I have got to go there and speak to this Dr. Schoenfeld and hear what they're saying. So I flew in, and I couldn't believe what I heard that day. I literally, was gobsmacked sitting listening through one presentation after another, cataloging injuries to children. And it was presentations of narcolepsy epidemics, aluminum-addled brains in sheep, cross-sections of brains of dead girls following the HPV vaccine, showing aluminum from vaccines in their brains, descriptions of translocation of aluminum into the brains of people, and questions by very high-ranked immunologists and toxicologists about the wisdom of using this in a vaccine.
So you were hearing lecture after lecture.
It was a day. It was 8 hours. I literally was just, oh my God, I have to tell people, you know. And it was horrifying because they know. It's like that was my thing. It's like they know right down to the mechanisms of how these things are disrupting our immune system. That when we put in xenobiotics, external things, toxins, we can lose immune tolerance. We can go from having an immune system that recognizes self as self to one that is going around like a Vietnam vet firing on everything.
Yes.
And in the case of my son, I was dismayed that mainstream medicine just did not see this. They don't see an injured immune system. So they don't look, you know, they're not looking at it.
They don't look, they don't
and
think about it.
You can't see the immune system. And, you know, my objective now is to inform parents, is to attend events like this and when I can and give them the lowdown on what's happening, because there is a wide gulf between what parents are told by the public health regulatory agencies about vaccines and about what's being said here by top immunologists. And parents have a right to know that, to make informed consent decisions for themselves and their children. And without information, you cannot make informed consent. And an adequate risk assessment.
I would highly encourage everybody to watch this series on autoimmunity. There's a very good chance that you will learn something new, and it may actually even change your life. So I hope you'll take the time to do that.
Today we can see that proper care of mental health can incredibly help with the healing of the autoimmune disease epidemic, even as simple as avoiding gluten. If you're struggling with symptoms such as depression or anxiety, it is so important not to hide anything inside. Instead, talk to someone who's been trained properly, such as a functional medicine doctor, who can walk you through and find true emotional healing. Also, consider the dangers of vaccination and make sure that you do your research properly before you come to any conclusions. Tomorrow we have a wonderful treat. We have a whole episode dedicated to autoimmune disease survivor stories. Come and watch the struggles of the people with autoimmune disease and their journey to healing. See you then.